The exercise forms part of efforts by the National Human Rights Commission to ensure that no one, especially vulnerable groups like people with mental health conditions, are given their dues and their rights protected to the fullest. Jennifer John, Vice Chairperson, National Human Rights Commission, disclosed that there is a lead to the 2019 Mental Health Bill, which she said, if validated, will play a crucial role in the development of the country. She, however, stressed the need for more mental health institutions in the Gambia.
Made so many recommendations to government then for us to lead us to come to this conclusion that if we have this advisory note, which is an advice to government that we should move ahead, it will now help us, government, to endorse the bill. And also because our visits to Tanka Tanka showed us that Tanka Tanka itself needs revamping. Because when we went there were certain things we saw, the management themselves spoke to us about things they wanted to be done. And we have it in a report which we had also submitted to government. So I hope as we go through these 2 days, that it will give us an insight as to not only mental health rights, but what mental health is all about.
The UN Resident Coordinator, Serafine Wakana, said the UN in the Gambia is pleased to partner with the National Human Rights Commission towards the formulation of a mental health bill. The UN Resident Coordinator said her office appreciates the findings of studies by many experienced persons that look into mental health conditions, including inadequate laws and policies, marginalization and discrimination, as well as exclusion from public and social life.
This validation is therefore very important to us. It reminds us to not forget the importance of socio-economic rights, and in this context, the right to health. It also provides pertinent recommendations on how we can progress on protecting these rights to ensure no one is left behind. The UN here reaffirms its commitment toward continued support to the government, to the National Human Rights Commission, and all partners in the promotion and protection of the rights to health.
Dr. Mustafa Bitey, Director of Health Services at the Ministry of Health, talked about the growing number of people affected by mental health conditions in the country, adding his ministry is working tirelessly to make sure that the law passed in 2019 is implemented to the letter.
3% of the adult population will have severe mental health disease. That could be approximated to almost about 50,000 people. If you see that about 10% of the beyond 15-year-old, about 10% of them will have maybe mild or moderate. That could estimate to almost about 200,000. So in total, you may have currently in the country up to 250,000 people having mental health issues.
In 2016, the government launched its first ever national social protection policy with an accompanying implementation plan. According to officials, the primary focus of the policy is to develop a robust and sustainable social protection coordination and delivery mechanism. According to officials, the primary focus of the policy is to develop a robust and sustainable social protection coordination and delivery mechanism, as well as providing a basis for creating an adequate and sustainable economy that caters for the needs of the most vulnerable in the society, including people with mental health conditions. Janket Ture, GRTS News.